Today we're following the everyday life of an American teenager. Except Selena has an uphill battle many teenagers are also experiencing, often secretly. Major depression. Major depression is a chronic, lifelong illness that can negatively affect one's school, work, and social life. According to studies by Stanford University, the most effective way to combat the drastic symptoms are combining a regimen of antidepressants with cognitive behavioral therapy. But before we get ahead of ourselves, let's meet Selena. Selena is an average teen who's been losing interest in schoolwork and exhibiting signs of fatigue.
You don't want him. He's not really a professional like me. Listen, you get that kid in here. We need more laughs on the show. Well, I guess he couldn't be any worse than Tim McCarver is at sportscasting.
In my view, as good as the Yankees were in the first half of this game, that's how as bad they've been now.
Can't.
She thinks of any excuse to avoid social interaction.
Hey, Selena.
Oh, Maya.
How have you been?
I've been okay. How are you?
I'm good. I'm good. You look like you've lost some weight.
Oh, I mean, I guess.
Oh, well, I just wanted to come by and make sure that you didn't want to go to the movies. A bunch of us are going. It's going to be really fun.
Yeah, I mean, I have this thing later.
Okay, well, if you're sure.
Okay, I'll talk to you later.
Okay.
She has even been struggling with suicidal thoughts. Selena's parents have recognized these changes in her and have called an intervention.
What's going on?
Honey, take a seat.
Okay.
We've been really worried about you lately. We've both seen how your life has been spiraling down.
Yeah, we realize this might be out of our hands, so we want you to get help professionally.
Help? I'm fine. It's not like talking about it will change anything. Nothing can help.
You aren't interested in your old hobbies, you barely eat or drink anything, and you don't go out with your friends anymore.
Your boss even called and asked you to take a leave until you're back to your old self.
I am my old self. Nothing can change and nothing will change. I mean, I may have been sleeping more and cutting back on some homework, but I'm fine.
We've collected some brochures about treatments we'd really like you to try.
And we even recommend Dr. Williams. She's been known to help many people, so maybe she could help us.
I mean, fine if it'll get you guys off my back.
Reluctantly taking her parents' advice, Selena agrees to get help from Dr. Williams, a renowned psychologist who graduated from Yale University.
Hello?
Hi, who are you?
Hello, Selena. My name is Dr. Williams.
Why are you here?
May I take a seat?
Sure, I guess.
I'm here because I specialize in the treatment of mental illnesses, and your family's concerned about you.
I mean, my family's kind of convinced there's something wrong with me, but I'll talk to you if it'll get them off my back.
And I take it you think you're fine? What exactly has your family been saying has been happening?
They say I'm losing weight and losing interest in things, and they also complain about my grades dropping. I mean, I guess they're not wrong.
I see. And how long have these things been happening?
About a month, maybe 2.
I see. Okay, I'm going to list some scenarios, and you're going to tell me if they sound familiar or not.
Okay.
When you're hanging out with friends, you find any reason to leave early or to not go. Your self-esteem has been dropping, and when you wake up after a full night's rest, you still feel tired. Anything familiar?
I mean, now that I think about it, I have been going through some of those things.
Okay, I think I have an idea of what's happening to you. If you're willing to see me a couple of times a week, try some medications and some other treatments, I think we can get you back to your old self. Does that sound interesting to you?
I mean, I seriously doubt that it'll help, but if you seem desperate to help me, so I guess I can try some things.
Perfect. I'll see you tomorrow then.
Okay.
Hi Selena, it's good to see you again.
You too.
So for today I brought over the pill options I think would work best for you. I brought over some selective serotonin reuptake inhibitors. They're the most common antidepressants. Their side effects include some nausea and an increase in anxiety. SSRIs are relatively the safest antidepressant. There are some older classifications of medications too, such as the monoamine oxidase inhibitors, or MAOI, and the tricyclic antidepressants. MAOIs were the first type of antidepressant developed, but they have side effects such as high blood pressure and diet restrictions. MAOIs aid in the production of norepinephrine, dopamine, and serotonin. Tricyclic antidepressants also block the absorption of serotonin and norepinephrine. The common side effects of these range from dry mouth to irregular heartbeat. Of course, we'll continue with our sessions of psychotherapy and behavioral therapy.
So which one of these would you recommend?
Personally, I would recommend the selective serotonin reuptake inhibitors, just because the MAOIs and the tricyclic antidepressants are usually given after the failure of SSRIs.
Okay.
After a month of taking a combination of meds, including selective serotonin reuptake inhibitors Prozac and Zoloft, which act as antidepressants by manipulating the neurotransmitter serotonin, and having weekly psychotherapy sessions with Dr. Williams, Selena has been able to eat more and has been working on raising her grades. She is no longer in denial about her mental illness, and although she still struggles with fatigue and feelings of despair, she is now dedicated to living a happy, healthy life.
Alright, not so fast. Oh my god,
So this is pretty much what we do to help people who are depressed smile. So you just...
Like this?
Mhm.
Okay.
Yeah.
Ready for the movies?
Sure.
Let's go!
Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel.
Your family's hired me because they're concerned about you. They say you've been exhibiting some strange symptoms lately.
Okay, wait. I
Sorry,
don't know
I
how
just
to
totally improvised that whole line. See you again.
too.
So for today, I brought the pill options I think would work best for you. We have some selective Hi, Selena. How are you today?
Good, you?
First, we have some selective serotonin reuptake inhibitors, which are the most common antidepressants. They work by aiding in the blocking of serotonin reuptake. I just made that up. We can't use that. I don't know.